I'm Dr. Clayton Molliver. I'm a clinical professor of plastic surgery at the University of Texas Medical Branch, and I'm a clinical editor of the Aesthetic Surgery Journal. Today, I want to talk to you about over the muscle or under the muscle as it pertains to breast implants and breast augmentation. So there's a common thread of misunderstanding in America about breast augmentation and the implant over or under the muscle. This all started in the early 1990s when there was a big problem with breast implants leaking. The implant material was very loose, silicone liquid. It wasn't until the mid-90s that they made the gummy bear, or what we call cohesive gel. So we started doing a lot of saline implants. And at that time, we were doing breast augmentations under the gland, not under the muscle, predominantly. When we put the saline implants over the muscle and didn't overfill the saline implants, as became the policy or the usual practice, they looked terrible. You could see the rippling in the implant, and they were just terrible. So we started overfilling them, and they looked even worse over the muscle because it was often very petite women that came in for breast augmentation. So we started putting them under the muscle, and that's where under the muscle really took off in America. When patients come in to see me, 95% say, "You're going under the muscle, right?" Or we say, "Of course, it's under the muscle." And that's become the norm. Around the world, that's not the case. Many times, in many places, it's over the muscle, and that's the way it's been done. But because of the way things progressed here in America, it's become the norm under the muscle. So let's look at that a little bit and understand it a bit more. So going up here, this is the breast, of course, and this is the pectoralis major muscle. It comes off of the clavicle, the sternum, and the fifth rib along here. When we do a breast augmentation, we release the muscle along here. We cut the muscle, which I'm telling you, most surgeons aren't really crazy about doing, and we're not happy about doing it, but you have to put the implant under the muscle. So when we do that, we do what's called a dual plane technique. We go over the muscle a little bit first, and then we go under, make our pocket, and then we release the muscle. When we do that, the muscle pulls back up to about this level or even higher. And what happens is we put the implant in, and the implant sits here. The idea is that this muscle is camouflaging the upper pole of the breast implant so that you don't see that implant through the skin. So this is what it looks like down here. With a submuscular implant, this is what it looks like. So when you're looking at the chest, you don't see the edge of the implant that you used to when you put an implant over the muscle in very thin patients. In heavier patients, it doesn't matter. And so that's what it looks like. The interesting thing to understand, and this is crucial, is that when you put an implant, quote, under the muscle, it's not totally under the muscle. It's maybe 1/3 under the muscle, because that muscle pulls up, and this breast stretches in this lower pole, and this implant drops with it. Some people, and historically back in the 90s, put an implant totally submuscular. Looks like this. These implants are very stiff. They don't move very much. There's a lot of flexing of the muscle. You can see the implants moving. You can see it moving here too. Under the muscle, you often see the implant moving with flexion. It doesn't move around very much. It's kind of uncomfortable. So very few people do a total submuscular breast augmentation. In fact, when we see that, we usually go in and repair it by releasing the muscle to allow the muscle to come up so you don't see as much animation, and it's a looser, more comfortable breast. But here's the interesting thing, is that this implant, quote, under the muscle, also called a dual plane technique nowadays, is for the most part under the gland. An implant over the muscle is, for the most part, under the gland. In fact, many times, as time progresses and this breast stretches a bit, it's only under the muscle in the upper pole of the breast with a bra on. Without a bra, mostly it's out from under the muscle entirely. So there's a kind of misunderstanding. People think under the muscle is always under the muscle. It's not. It's mostly under the gland. So many times when people go see a really well-trained plastic surgeon and they say, "Oh, it's under the muscle," sometimes we have to sort of talk people through why you might be a better candidate for over the muscle. Maybe you have a particular constricted or tuberous or tubular breast that we want more expansion of the breast tissue, and over the muscle is a much better technique. Also, it hurts less. But then there are downsides. Many people believe that implants under the muscle preserve some of the suspensory ligaments that come off of the muscle that help support the breast. Many people believe that hardening of the breast implant is higher or more prevalent when it's over the muscle. At the end of the day, it's important to understand we're dividing the muscle. And that's not a great thing to do to someone's chest for long-term health and strength and everything else, although most people do fine with it. We prefer not to be truthful, but there are some pros and cons in terms of breast lift later on down the road, what happens to the breast, and does it drop more or less if it's over the muscle or under. The thing I'm trying to tell you today is when we put an implant under the muscle, it sees a ton of breast tissue, whether it's over the muscle or under the muscle, because of the way this whole thing winds up being. I hope that's clear. If you have any questions, please post them on this post or send me a DM. I'm happy to answer them. That's it for today. Take care.